Hey, boo, you're back. Welcome to Inside the Dollhouse, where the vibes are high, the recovery's real, and we don't gatekeep the good info. I'm your host, Nurse Dripiana, licensed, unbothered, and fully booked, baby. If it involves compression socks, spiritual alignment, or IV bags with vitamin drips, I'm your girl. Now, today's topic is for everyone and anyone who's spending five, 10, $15,000 on your surgery and have not even thought past discharge from the surgical center. Our topic is, do you need a post-op nurse or a caregiver do the job? What's the difference in how to avoid wasting your money or worse, risking your safety? This is for educational purposes only, not medical advice, but I'm going to give you the blueprint anyway. Let's go. What is a post-op nurse really? Let's get something straight. Anyone with a blood pressure cuff and a YouTube video can check vitals. But baby, do you know or do they know what those vitals actually mean? You may know, they may not know. And if you're down and they don't know and you know, we're still at square one. Is 140 over 90 post-op dangerous or expected? What does low oxygen mean on day 2 versus day 5? How often should vitals be checked post-lipo or post-BBL? What's the difference between a temporary drop and a medical emergency? Checking vitals is not the same as interpreting them. That's where the training kicks in. A post-op nurse isn't just documenting numbers. We're assessing trends, evaluating clinical signs, and making judgment calls that protect your life and your investment. We don't panic. We prioritize. And when something is off, we know when to call the surgeon, when to hydrate, when to pack the bag and head straight to the ER. Because real post-op care is more than help. It's oversight. So while your cousin might have watched 3 TikToks and knows how to take a blood pressure, ask her if she knows the signs of a hematoma forming under a new breast implant, the difference between normal drainage and early infection, when a heart rate post-lipo is normal and when it's clot forming. And if she doesn't, you know what you need to do. Now, say you can't afford a nurse. Let's talk caregivers. Now, sis, not everyone needs a full-on nurse. Maybe you don't have drains. Maybe your meds are oral and simple. Maybe you just need help getting in and out of the bed, preparing some light meals, or just keeping your space clean, maybe a shower. If a licensed nurse is out of the budget, don't cancel the whole plan just yet. That's what a post-op caregiver is. That's where they come in. A caregiver is a non-medical support person. They're trained to assist with walking, toileting, bathing, keeping your space clean and safe, changing your pads, putting on your faja possibly, helping you change your garments, your robes, helping you with laundry. They help to cook and prepare your meals, remind you of hydrating, make sure you're eating, right? They keep track of when you're taking your meds. They do not administer. That's a nurse's job, but they are helping you to remember the times you've taken them and what to take. Companionship. They're often CNAs or HHAs, and they are significantly less than a nurses may charge, say, $50 to $125 an hour, depending on location, skill set. Caregivers often range between $20 and $45, or even offer flat overnight rates. If you want the best of both worlds, which I've seen a lot of dolls do, they do a nurse for day 1 or day 2, both, few hours after surgery, and then the next day to check. And then they transition to a caregiver from days 3 to 7. Some dolls do a nurse for day 1 and 2, or day 1 or 2, preferably day 1 if you're going to choose to do a nurse for a few hours, minimum, at least surgery day. 3 to 4 hours to make sure that your vitals are stable, there's no issues, and then transition to a caregiver on day 3 to 7. The bonus is doing that, caregivers are often more affordable than licensed nurses, especially for clients staying longer than 2 to 3 days or on tighter budgets. And you can have quality on a budget if you vet them properly. Common myths that get dolls in trouble. I love busting myths, so let's bust a few real quick. Myth number 1, my friend can help me. Okay. Reality is, unless she's a licensed nurse or trained caregiver, she's winging it, and that can be dangerous. Even if she's had the surgery and been there before, every person is different. Myth 2, If I go to a recovery house, I don't need outside care. The reality is, most recovery houses are not medical facilities. Some don't have RNs or nursing staff on there 24/7. They also, some of them don't allow you to bring outside providers for massage or IV therapy, or if you have a concierge nurse that you want to check on you during your time of recovery, they're not always available. Myth 3 is just lipo. I'll be fine. I've heard that way too many times. The reality is, lipo can drop blood pressure, cause fluid shifts, and leave you dehydrated, lightheaded, mad at the world. I mean, I've seen people faint, have to call emergency room, and simply because they thought they were just doing lipo, they didn't even provide care. They didn't even plan for a care provider. So they end up in crisis. And I get those phone calls. I get those phone calls 11:30, 1 a.m. in the morning. I need help. I should have gotten my IV. I shouldn't have done this by myself. I shoulda, coulda, woulda. I hear you and I show up because it's very important. You're going to learn through this experience. You're going to learn that even though it's just lipo, it is necessary to have somebody to care for you, because it's not just general anesthesia when they put you under. There's a breathing tube put down your throat, even for just lipo. So they have to keep you on a breathing machine during your surgery. That means it's major surgery. Like, let's be real. Lipo, if you're having just lipo, the recovery time can be a little bit less, especially if you do a pre-op IV. You've been preparing your body with your nutrition, your hydration, your diet, exercise. Getting your body fully prepared for the actual procedure can allow the recovery time on the other side to be a little shorter. I've seen dolls get lipo and they're back home in 2-3 days. This may not be everybody, but I have seen it. Myth 4, I'll save money by skipping this. Don't skip anything, okay? An ER visit is more expensive than a nurse or a caregiver, okay? ER visits, especially if you're traveling from out of town, minimum $2,000, and they probably will just give you a bag of saline and a little bit of a dose of disrespect and judgment, and then send you on your way. This is your body, okay? This is your investment. Don't just hire the first pretty flyer you see. One of my clients once said, I don't think I need a nurse. I just need someone to, just check in on me. I hear you, but that doesn't always work out either, because remember, you have to prepare yourself meals. The last thing you want to do is when you're feeling sick, you're in pain, nauseous, is to get up and make food. You're not going to make sure that you eat. You're not going to make sure that you drink. You're not going to make sure that you get up and walk every 2 hours. That's the last thing you want to do. So having a caregiver is super, super important. It's super important to research the caregiver. When things get a little dicey, you want to have somebody there so you don't have to worry. The recovery process is mental just as much as it is physical. So you don't want to have to be thinking about all these things. Everybody on Instagram looks official these days. They have their ring lights, their logos, their pretty pictures, their CapCut videos, but don't let the aesthetic fool you. When it comes to hiring somebody to take care of your healing body, you better vet them like you're applying to work at the White House. Here's your checklist. We're not checking vibes. Not she seems nice. We need proof, receipts, skills, boundaries, period. For post-op nurses, ask for license verification. Don't just ask if they're a nurse. Verify that license. It should be active and valid in your state or in the state that they're working. Insurance. This is a big one. Liability insurance protects you if something goes wrong. This is a non-negotiable. And so many people are practicing, especially here in Miami, without insurance. So ask the question, sis. I want you to also ask procedure-specific experience. Have they supported clients through BBLs, Lipo 360, tummy tuck, breast augmentations, or any other procedure you may get? Just ask. Reviews and references. Don't just stop at stars. See if you can call past clients. Find them on Facebook. See how the provider handled pressure, complications. Also, you really want to know if they are CPR, BLS certified. This should be current. If they can't handle an emergency, they shouldn't be in your room and you shouldn't be in theirs. For post-op caregivers, look for their CNA or HHA certification. If they're certified, great. If not, ask for experience and a resume. Interview questions. How many recovery clients have you supported? Are you comfortable assisting with garments, hygiene, light cooking? Are you good at cooking, for real cooking? Because that's important. Nutrition after surgery is very important. You don't want high sodium, high sugar, and you want it to taste good. You're healing and you need some type of comfort. Ask them, what would you do if I faint? If I started bleeding through my garment, what's your first move? Do you have overnight experience? Recovery just doesn't stop when the sun goes down. Confirm they can stay awake and alert if needed. And you always, from any provider, you always want a written agreement. You want to outline the hours, the expectations, the tasks, the emergency protocols, and exactly what the price that you're paying includes. Some red flags to watch out for. They're unwilling to provide proof of credentials. That's a big one. They give vague answers about experience. Oh yeah, I'm good at what I do. Do you want a book? Here's my Cash App. No. No references, but plenty of selfies and scrubs. Red flag. The I got you, girl. I got you, girl. No, you don't got me if you don't have a clear recovery plan. They get offended. If they get offended when you ask too many questions, that's a major no-no. Let me remind you, cheaper doesn't mean safer, but expensive doesn't guarantee excellence either. Vet with your brain, not your panic, which is why it takes time to prepare for a surgery. You're not just hiring help, you're hiring a partner in your healing. Because when you're swollen, sore, disoriented, and vulnerable, the last thing you want is someone fumbling through YouTube trying to figure out what a surgical drain is. Lord help me. Whew. Real talk from the recovery trenches. It's all good until it's not. Let's be real. People glamorize surgery, but what happens after the OR is where the real story unfolds. That part is not about scare tactics. It's about what actually happens when you're underprepared versus when you make informed decisions. Let me give you two real life scenarios that speak for themselves. Case number one, the I thought I'd be fine. She came solo. She booked her Airbnb, no nurse. Told herself, I'll manage. By day 2, she was weak, dehydrated, disoriented, no food, no support, no plan. She blacked out in the bathroom and ended up being rushed to the emergency room. Not only did she have to pay hospital fees, but she ended up hiring post-op support after the fact at a much higher cost, emotionally and financially. Case number 2, prepared, not panicked. She had the same surgery, same city, different approach. She booked 48 hours with me, then hired a trusted caregiver to finish the week. Vitals were tracked, meds stayed on time, meals were prepared, swelling was monitored, IVs were administered. She had a low-grade fever that started on day 3, but we caught it early and handled it without incident. She was stable, cared for, and on her flight home with confidence without complication. What's the difference? One had support and the other had assumptions. This is your reminder. Recovery doesn't care about your intentions, only your preparation. Whether you choose a licensed nurse or skilled caregiver, make sure the person watching over you knows what to do when your body starts whispering before it screams. You only get one chance to heal right. Don't wing it. Now, do you need a post-op care nurse or a caregiver? Let's get real about your reality. Not everyone needs 24/7 medical care, but almost everyone needs something, especially in the first few days, first few hours post-op. So if you're still unsure whether to hire a post-op nurse, caregiver, or just phone a friend, let's walk through it together. I'm going to give you a little post-op self-check quiz. Do you need a post-op nurse or caregiver? Let's get real about your reality. Not everyone needs 24/7 medical care. Let's just get that clear. You know, some people have pre-existing conditions. Some people need to be monitored a little bit more. And those people may need a little additional care. However, if you're pretty healthy, you see the doctor as often as you need to, and you've prepared for this, you're going to be needing less care. Not everyone needs 24/7 medical care, but almost everyone needs something, especially in the first few days post-op, first few hours, certainly. So if you're still unsure whether to hire a post-op nurse, caregiver, or just phone a friend, let's walk through it together. Here's your post-op self-check quiz. No sugarcoating, just clear, honest question. Ask yourself, will I be recovering alone? If yes, you likely need at least a caregiver, especially for the first 24 to 48 hours. 72 if you can. Even more if you can. Will I have drains, fajas, compression garments, or medications? If yes to any of those, you'll want someone who understands how to manage all of that without stressing you out. Do I know what normal versus abnormal swelling, bruising, or pain looks like? If no, you need someone who does. Early detection prevents emergencies. Can my friend or family member actually handle what post-op care involves without panicking or freezing? Be honest. Loving you doesn't mean they're trained to care for you. And don't get me wrong, some people have superb support. Just know your candidates. Am I comfortable being exposed, vulnerable, and dependent with whoever is around me? You will be exposed and you will be vulnerable for a few days. This is just the process. You'll need help bathing, dressing, peeing. It gets real. Things are just going to be pouring out of your body that you've never seen before. And it can be very emotional. And you're going to be showing people things that you didn't intend on showing people. You know, the showers, when they take off the faja, the massages, you're pretty much naked. So make sure that the person that's caring for you is not somebody who you feel is going to inhibit you from being able to be vulnerable. A lot of the times you'd say you're going to bring your friend or you're going to bring your cousin, but have they seen you naked? Have they seen you in this position before? You want to be free to heal, free to relax, free to be. You know, this is your time and you need somebody who's going to allow you that. Can I physically cook, hydrate, get up to pee, and move around safely in the first 2 or 3 days? If not, which most likely it's going to be a challenge for most people, but if not, you need help, period. The thing is, if you're not feeling well, you are not going to want to cook. Maybe you can order DoorDash. It's probably going to be high in sodium. Hydration, unless you have the water bottles right next to your bed. There's so many things, and you're like, I'm going to get up. I'm going to get up. I'm going to get up. Give me 5 minutes. Set an alarm. 5 minutes. I'm going to get up. All right. 15 minutes. I'm going to get up. All right. I want to pee. This is not where the adult diapers come in. Okay. It's very important that you get up and you move. It helps with circulation. It helps with healing. You know, it provides oxygen to the places that need the regeneration. Like there's reasons why you need to get up. And if you can't get up because you don't feel good just to pee or grab some water, you're definitely going to need help. Even in the first 2 days, 3 days, I've seen it. Day 4, person's by themselves, and we end up having to go and show up and figure it out. You don't want to have to do that. Yes, the help is there if you have access to that type of help, but we don't want to have to come and save you. Do you want peace of mind or just the bare minimum to survive recovery? That's a big question. Do you want peace of mind or just the bare minimum to survive recovery? Peace of mind can go so far. Peace of mind is how you thrive, not just survive. You got to choose peace. Your body deserves more than just getting through it. This is something that you have to know. I'm telling you, and I hope you're still watching and that you understand that I want peace of mind for you. Your body deserves it. If you answered yes to 2 or fewer of these questions, you might be okay with a trained caregiver or a super prepared loved one. Still confirm support. Ask these questions. If you answered yes to 3 or more of these questions, you'll benefit from a nurse for at least the first 48 hours and a solid care plan after that. If you answered no to most and you're recovering alone, call me ASAP. If you're going to be in South Florida, call me at 754-305-3408. This is not the time for ego or assumptions. The number again is 305-3408. This isn't about scaring you. It's about equipping you. Because when you don't know what's normal, every twinge feels like a 911 call. Recovery is not just physical, it's emotional, mental, spiritual, and your care team should match that energy. I hope you found something valuable in this podcast episode, as this one was very exciting for me to deliver and share with you, because our goal here at Dollhouse HQ and Dripping Wellness, the sister business where we provide concierge IV hydration and vitamin therapy, is that you thrive and not just survive. That is the whole mission. Surgery is supposed to be an exciting time, a time for renewal, a time for emergence of the beauty that you know you have within. Surgery is a time for you to start fresh. It's a time for you to thrive. It's a time for you to thrive. So I want to share with you what's coming next week. Just like that, you deserve to thrive, not just survive. The goal isn't to recover. I'm going to say it one more time. Thrive, right? The goal is not just to recover, it's to thrive. That's not a catchphrase. That's the mission behind everything I do with Dripping Wellness and Dollhouse HQ. We don't just show up with IV bags. We show up with intention, experience, and real care. We advocate, we educate, and we hold space. We hold space for your full healing, mind, body, and soul. So whether you're local to Florida or traveling to Miami for surgery, if you want to partner in your recovery, not just a provider, if you're looking for one-on-one prep, surgical coaching, or IV support before and after your procedure, if you need iron infusions, hydrations, or vitamins tailored to your recovery plan, I'm here, and I'd be honored to be a part of your care team. Visit thedollhousehq.com or call 754-305-3408 to schedule a consult or book your drips today. Coming up next on Inside the Dollhouse is Inside a Recovery House. Luxury healing or pretty packaging? Is it really worth the hype or just a mood board with no medical oversight? We'll get into what to ask, what to avoid, and how to make sure your recovery space is actually set up for healing and not just Instagram stories. Until next time, this is your girl, Nurse Dripiana, signing out.